Coronavirus, SARS CoV-2, the official name of the virus that causes the disease now termed COVID-19. I don't know about you, but this has occupied the major part of my mental bandwidth for weeks now. I haven't made a video in a while, and the reason is this wave of viral pandemic that has swept the world. I'm finally stopping to talk because I have something to say. The reason I say I don't know about you, how much this has occupied your attention, is that I've noticed a striking dichotomy around me. There are people like me who've been unable to avert their eyes from this slow-moving train wreck that is this disease. And for me, that unswerving focus began sometime in late January and hasn't stopped since. But then I encounter other people who report feeling unconcerned, who draw parallels to seasonal influenza and annual death rates, and are comforted by not falling into a high-risk group, or who think those who are concerned are overreacting. So I don't know how much this has been occupying you, but for me, it's become harder and harder to have any conversations where coronavirus is not the topic. So if you're like me, and this has been occupying a lot of your brain space, there's been kind of a narrow path to walk between my intellectual position, which I'd characterize as something maybe called rational preparedness, and trying not to provoke anxiety either within myself or among others. And I haven't fully solved that problem, but some things just need to be said. So I've made videos regularly for almost 2 years now, and I just couldn't do it recently. I just couldn't make a video because I was just so laser focused on what's going on in the world. And during that time, I might have told you some things that you didn't already know. I was letting everyone I know understand that a tidal wave was coming, something unprecedented in our lifetimes, and you need to get prepared and get supplies and be prepared not to go out for a while and wash your hands and don't touch your face and so on and so on. Now I'm ready to start making videos again. And there will be more videos on coronavirus because what else am I going to make videos on at the moment? But all the things that I was telling people about, you now know. Keep in mind, I'm making this video on March 12th, 2020 in the United States of America in a rapidly changing situation, and maybe things will be radically different when you watch this video. I don't have information that most people don't have, so I want to focus on one thing today. It's really, from a societal standpoint, the most important thing. And boy, if we don't get the message, and quickly, we are in for hell. I don't exaggerate when I say this is the most dangerous biological threat in almost all of our lifetimes. Unless you're 101 years old and lived through the end of the 1918-19 Spanish influenza pandemic, this is the gravest infectious disease threat in our lifetimes. If you don't already believe that, I'm not going to prove it here because I need to get on to a more pressing point. My point for today. Look at the societies who have managed this disease and come through it. China. Whatever you believe about the numbers, it doesn't matter. They mobilized their resources to clamp down on movement and to ensure social distancing in a dramatic and costly and ultimately effective way, remarkably reducing their COVID-19 cases. South Korea threw everything they could at the virus, from incredibly impressive buildup of testing capacity and implementation, to radical social distancing, to anything else they could think of, including disinfecting the streets regularly. And what happened? They got control of their cases. They reduced it to manageable levels. Not that there wasn't sickness and death but on a scale so much lower than otherwise would have been. Right now, Italy has been hit with the tidal wave. The accounts of overcrowded hospitals, too many patients, too few ventilators, people dying for lack of care despite the heroic efforts of doctors and medical personnel. It's terrifying and heartbreaking. At last, they've done what needs to be done. They've shut down the country. The lesson may have come late, but at least they've learned it, and we'll see the results. I don't know whether you like graphs and charts. I do. And this one is important. This shows simulations recently modeled by the Institute for Disease Modeling in Bellevue, Washington. It's a model of what happens to the number of infections in the case of various degrees of social contact reduction. In this case, the modeling is for the counties around Seattle, Washington. Focusing on the lower chart of active infections, you can see in blue the results of no change in contact, what they are calling business as usual. The yellow line shows the effect of a mere 25% reduction in contact, and you see that by April 5th, the expected almost 17,000 active infections are reduced to under 6,000. The green line shows a 50% reduction in contacts, and active cases are down to 2,000. And the red line, 75% contact reduction, shows a downward curve with a diminishing number of active cases. So the message from East Asia and from past studies of social distancing in other epidemics, which I haven't talked about today, and from the charts I just showed, is very clear. We cannot stop this epidemic with more ICU beds, or from the rapid manufacture of more ventilators, although these would benefit those who are already sick. But we can stop it if we act now. If we have the courage and the will to take difficult steps for the sake of preventing abject catastrophe. We must shut down ordinary life in ordinary society temporarily. These are not ordinary times. These are times for radical measures, and we must make the sacrifices those measures call for. I will end by quoting Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, speaking yesterday, March 11th, 2020. He said, quote, "Some countries are struggling with a lack of capacity. Some countries are struggling with a lack of resources. Some countries are struggling with a lack of resolve." Unquote. How true. We can control our resolve, and in so doing, control this disease. The task is clear. Let us go meet the challenge. Thanks a lot for watching.